Casting Crowns, music by Nathaniel Bassey and Love Song, playing on Hope FM. Listen and leave. It is now 11 minutes past 8. Welcome to the second hour of Breath of Heaven. It is Thursday edition, and tonight we are all about the health of our bones. And in case you're joining us right now, you're most welcome. We are doing the second part of this. We're also live on Facebook as well as on YouTube, Hope FM Live. Get us there and share this valuable information that will help someone as well to get the information that is necessary. Dr. Felix Kuguru is with me tonight all the way till 9. Yes, and he'll be looking at those questions. You send them to 20933, WhatsApp on 0717 400 555, Facebook, Twitter, Instagram at Hope FM Live. And tonight we're using the hashtag Thursday edition. And somebody here on Facebook is telling us that happiness helps your bones to be healthy. What do you reckon?
Well, I've not seen research towards that end. But if one part of your body hurts, then the whole body does hurt. So if you are happy and you're content, maybe, but I cannot speak in an official capacity to give a yes or no answer. Mm-hmm. Dodge that like a politician.
All right. So let's carry on. Many questions are coming through, and we'll look at them. Here is one from a listener who says, hey, I've been having back pain since 2018. Those are like 4 years or so. And I've been under medication since then, including physio. But still, I have pain. Kindly advise.
Okay, so you have given, sounds like you've given 4 years worth, at least 4 years worth of conservative management. Success or failure of conservative management is not necessarily lack of pain. You may have a reduction in the amount of pain and the ability before maybe you are not able. So we look at it in terms of your quality of life. Are you able to do the things that pertain to you? Your day-to-day activities of daily living, are you able to perform these things? If your answer then is there had not been any improvement in my symptoms, the pain is actually getting worse, I'm no longer able to go to work because of this pain, then you now start thinking that we are a candidate that is moving towards a more aggressive form of treatment. And a graduation into possible injections, epidural injections into your back versus even surgery. Because I think 4 years of correct physiotherapy, 4 years of correct medication is enough time for conservative management. However, it's important to say if my shoe is worn out, and then I do some first aid to the shoe, it does not make the shoe any less worn out, because we have said that it is a wear and tear issue. So that's why I'm saying that I might not expect you to have zero pain, but I should have some improvement in your symptoms. So whoever has been following you up, then maybe that's a discussion maybe that you need to have with them. Then you can be able to see how to proceed from there.
All right. Let's look at this other one here coming through, saying, I injured my knee joint in an accident a year ago. It's swollen and very painful. I am 55 years. Can surgery be avoided?
So a direct answer to that is it depends on what the problem is. So if you had an injury and fractured your the bones around the joint, so maybe the top part of your leg bone or the bottom part of your thigh bone, or even the kneecap, then if you had a definite fracture or an injury of the structures within the joint, then you can be able to then, once you know what the injury was, then you can be able to know whether it can be managed operatively or non-operatively. A lot of the things can be managed non-operatively, but also some things need to be operated on to avoid worsening of the joint and even developing early osteoarthritis. So it will depend. So my answer is it will depend on what the injury is. So if it was a definite fracture, then to what extent was this fracture? How severe was this fracture? If it is a structure within the joint that has been injured, the meniscus, the ligaments that hold the joint together, then that needs to be assessed as well. Or even there could be a cartilage issue, for example, or the cartilage is worn out, or it has been bruised. Then all that will inform. Once we know what the disease is, then we can then be able to know how to treat it.
All right, thank you. I hope that helps this listener, as well as they're very, very keen on what to do next. All right, let's get to another one here. Keter, thank you for joining us. You say, I've been having back pain that was affecting my left leg. After an MRI, I was told the problem was, I hope I'll pronounce this right, lumbar spondylosis, and sent for physio. Is this enough?
In a large percent of patients, as I was telling you, about 90 to 95% of patients, it is enough to give you resolution of symptoms. So the hard word there that he used is basically describing, we always like to sound like lawyers, having very big terms, ceteris paribus and all those things. But spondylosis is basically one bone of the spine moving maybe forward, and the one at the bottom remains where it is. So it can cause, so when it does that, and there is this spinal cord that is passing inside it, so if one moves in front, then of course you can see that there can be a bit of kinking. So usually, as I've said, any patient who comes in, if we took all our patients for surgery or for more invasive treatments, as at the first time that they came into the hospital, then we took so many people to hospital. If you do an MRI on my back today, on my lumbar spine, my cervical spine, even you, if you do one on yourself, you'll always find changes. You'll always find that there's a disc that is not sitting right. You'll see that there's a disc that is not healthy. So trust the process. The first 2 months, usually in a large percentage of patients with correct physio, correct medication, those are able to resolve. For those patients that who have a more severe disease burden, then there are always options available to them. Surgery does not take away your pain 100%. You could have surgery and you could have pain. So even when I'm counseling my patients on spine procedures, I usually tell them that my objective is not necessarily to make you pain-free, because that I cannot promise you. My biggest thing is to provide space for your nerves and for your cord, and that will hence there'll be no deterioration. But pain should not be a reason for you to go, should not be the only reason for you to go into surgery or anything like that. So my advice is just trust the process. If it has been a couple of weeks, just give it time. Give it 2 months. See how you do. Then if it does not work, then you have not burnt any bridges. You're still amenable to these other options.
All right. Thank you for that. So elaborate, all right? And especially today, we've been looking at mostly back problems.
Back problems.
Yes.
Yeah, it's a common problem.
Yes, very prevalent right there. All right. Joe Irungu on Twitter, you say, praise the Lord, amen. My question relates to lower back pain, which does not cause numbness, but affects the sitting posture and activities done while bending. What causes it, and would you recommend physiotherapy for the same? That's for a middle-aged individual.
Correct. So we're seeing more and more patients with lower back pain. And these patients describe themselves as, I wake up in the morning, go sit in my office, leave at the end of the day, and that has become their lifestyle. The sitting position is quite important. How we sit, what type of seats we use, how long we sit. As I said, we are built to move, and failure to move will cause young patients. I usually see it in 30-year-olds, 40-year-olds who have this lifestyle of sitting in an office the whole, all day. So what I had said when we were starting, I think, first of all, involve yourself in some form of exercise. Around 30-40 is where we start seeing a bit of a belly growing, and that is usually a bit. I'm not saying that to say that I don't have my own, but but I'm working towards better.
All right.
That extra weight, that extra and that lack of activity then puts you at a point of having back pain. So physiotherapy is actually, the way I think about it, is activity, and activity to strengthen the muscles that are around. So see how you can involve yourself in a sport, involve yourself in running, involve yourself in this activity or that activity that gets you active. And then see how you move on, how you get along from there. But physiotherapy goes a long way. You'd be amazed by the results that physio gives.
All right.
Yeah.
Thank you for that. I see another one here saying, hello, Daktari. I am a lady aged 42 years, and when I gave birth to our second born, I developed a back pain almost at the end tail of my back. I also do customer care job, which I sit for almost the whole day. I've been taking painkillers for several years now, and pain is getting worse. What do you advise? Because I have 4 children already. When I take strong painkillers, the pain goes and then comes back later on.
Correct. So we see a lot of females post-delivery having lower back pain. So there's something about the hormones that are... So for you to be able to maintain the pregnancy, okay, for a lady to be able to maintain their pregnancy, there are some hormones that go up, there are some hormones that go down. So there's a hormone that causes relaxation of some of the ligaments that support the back. And that hormone can persist, and that pain. So a lot of females get a lot of back pain during pregnancy, and even the extra weight of the baby and the structures that supporting this baby. So even in the post-delivery period, these hormones take some time before they come down. So with this, then the patient will tend to have back pain. She said that is from from her second delivery, and now she has 4 kids.
Yes.
So it would be good to see, because she's saying that meds are not helping. What type of meds is she taking? And there's a danger of taking long-term meds. So a lot of the people, sometimes when you go to some hospitals, you can be given either a steroid or what is called an NSAID. So the diclofenacs, the cyclofenacs, all those drugs. All of these drugs have some side effects, and long-term use of these drugs also is not very good. Even in some elderly patients, there is a cardiovascular risk. So there's a risk to your heart and to your circulatory system with long-term use of these drugs. So we should have a diagnosis. I usually feel like if it's not working, then your diagnosis, you need to check what your diagnosis is. So have someone evaluate you, examine you, even go ahead and do an X-ray, do an MRI, consider physiotherapy. Then if once we have our diagnosis, then we can be able to treat from there.
Mm-hmm. All right. Thank you. And I hope that helps that our lady there, and any other one who has been in such a situation to find help. All right. Purity, you are here with us, and you say, a week ago I started feeling pain on my wrist, especially under some pressure. And there is something small looking like ganglion. What could be the problem?
She has given a diagnosis. She sounds like she knows what is happening. There is so there is the joints of the wrist. So we have a couple of joints at that point. So sometimes it can wear out. These joints can wear out, and there can be an outpouching, a growth of a fluid-filled pocket. And this fluid-filled pocket is sometimes called a ganglion. So there could be many reasons why she could have wrist pain, but now that she's mentioned ganglion, then maybe I'll stick my discussion to that. So ganglion cysts have a myriad of ways that they're treated. I treat mine with forgetting about it, neglect, and not doing anything. So the activities that you'll notice once you do them, then it usually tends to worsen the ganglion cyst. These, once you avoid those activities, once you know that either when you put your wrist in this position, then it worsens it, then avoid doing that. So if in those persistent ganglion cysts, then it's possible to go in and take it out. However, the biggest concern would be recurrence, that it can be taken out, then it comes back after a couple of years. So how I treat mine is that I just leave it alone. Avoid those activities that give me a problem, and I have had minor problems with it. But if it becomes a problem, then there is an option of taking it out.
All right. Thank you for that. Dr. Felix is joining us tonight to look at your questions regarding the health of your bones. And you keep sending the questions to 20933, WhatsApp on 0717 400 555, and we will be able to examine your